Lifestyle can have a significant influence on the development of hyperuricemia and gout. Accumulated data from several large epidemiological studies suggest several possible modifications for significant reductions in gout risk. Increased body fat is associated with increased uric acid levels and gout. Beef, pork and lamb are high purine foods, and they can significantly increase the gout risk. Carefully balance the benefits of omega-3 fatty acids with the increased gout risk, or consider taking an omega-3 supplement. High-quality fish oil supplements are highly purified, and the purine content in the oils is either undetectable or present in only trace amounts. Dairy consumption is inversely associated with gout risk. Nuts and legumes are good sources of non-uricemic protein. Legumes and vegetables, even those high in purines, are not associated with a gout risk. Moderate alcohol consumption has cardiovascular benefit, but beer and spirits significantly increase the gout risk. Red wine, on the other hand, appears not to increase the gout risk. Fructose in beverages can increase the hyperuricemia and the gout risk. But fruit also contains sugar, and this is usually present in lower levels, and it can have health benefits. Vitamin C is an essential water-soluble antioxidant. It's been shown in lab tests to exert a uric acid lowering effect by inhibiting the enzyme xanthine oxidase. In a comprehensive review of 13 randomized controlled trials, in a total of 556 adults with normal kidney function, an average reduction in blood uric acid of 0.35 milligrams per deciliter was observed for an average dose of 500 milligrams of vitamin C per day. The most significant reductions were observed in the people with higher initial baseline uric acid concentrations. In a large study on 184 healthy subjects, vitamin C also increased the glomerular filtration rate, the rate at which the blood is filtered in the kidneys, when compared to the control group. Future trials are necessary to determine if the vitamin C intervention can prevent the incidence and the recurrence of gout. Plasma levels of vitamin C are also inversely associated with blood pressure, and this might be an independent risk factor for gout. Cherries are a traditional gout treatment, and they're rich in polyphenol antioxidants. And a small set of clinical cases in the 50s documented decreased duration and severity of gout attacks in 3 people who were on cherry supplemented diets. 2 more recent investigations demonstrated a potential role of cherries in the management of gout, although they present conflicting mechanisms for the action. After a single dose of 280 grams of cherries, blood urate levels in 10 healthy women dropped by 14% after 5 hours, while urinary urate levels increased. C-reactive protein, a marker of inflammation, also decreased slightly. A second study on 100 patients with recurrent gout who were taking 15 milliliters per day of cherry juice concentrate for 4 to 6 months also revealed there was decrease in the marker of inflammation, as well as a greater than 50% reduction in the number of acute gout attacks for 92% of the treated patients. However, the uric acid levels were not lowered in this group, and they averaged 7.8 milligrams per deciliter. Although it appears that the cherries reduced the frequency of the gout attacks, the mechanism for the action clearly doesn't depend solely on lowering the blood uric acid levels. More than 50% of Americans drink coffee, and the average per capita intake is 2 cups per day. Coffee contains both caffeine and polyphenolic antioxidants, and it can have independent roles in the reduction of gout risk. The relationship between coffee consumption and the risk of gout has been examined in 2 large observational studies. In the Nurses' Health Study, 89,433 women who were tracked for over 26 years for their consumption of coffee showed that those who consumed the more coffee had the lower risk of gout. The largest reduction in risk was observed in the women who consumed over 4 cups of caffeinated coffee per day, a minus 63% risk, although modest consumption of decaffeinated coffee greater than 1 cup per day reduced the gout risk by 23%. In the same population, tea had no effect. A similar study on 45,869 men for 12 years demonstrated a similar effect for both caffeinated and decaffeinated coffee, which was significant at the coffee intake of over 4 cups per day. Much of the protective effect of coffee against acute gout can be attributed to the caffeine in the above studies. Caffeine is a competitive inhibitor of xanthine oxidase. The protective effect of the decaffeinated coffee suggests other compounds can also be important. For example, some evidence suggests iron overload can contribute to the development of gout, and chlorogenic acid from the coffee has been shown to reduce iron absorption. Conventional coffee, due to the roasting process, contains very little chlorogenic acid. However, recent innovations have led to the availability of green coffee extract, which is high in chlorogenic acid, and this can be taken in the form of a supplement. Green coffee extract supplements are a superior source of the chlorogenic acid and other helpful coffee compounds when compared to conventionally roasted coffee beans. An analysis of fiber intake in 9,384 adults without cancer, diabetes or heart disease for the National Health and Nutrition Examination Survey from 1999 to 2004 revealed a significant association between higher fiber intake and lower hyperuricemia risk. The study used a higher blood uric acid limit for the definition of the hyperuricemia, and it demonstrated a 55% reduction in the hyperuricemia risk between the highest fiber consumption of 9.5 grams of fiber per 1,000 calories. A smaller case-control study with 92 gout patients and 92 gout-free controls demonstrated statistically significant reductions in the risk of gout among the people with the highest intake of total and soluble fiber. While the mechanisms for the reduction is unknown, dietary fiber may inhibit purine or adenine absorption in the digestive system. Fiber has also been shown to reduce other independent risk factors for gout, including hypertension and high cholesterol. A small case-controlled study showed a statistically significant reduction in the risk of gout among people who consumed over 51 micrograms daily of folate from food sources. There was a 70% reduction compared to those who consumed less than this value. Several Chinese medicinal herbs have been tested for xanthine oxidase inhibitory activity. The most active was a methanol extract of Chinese cinnamon, followed by Chrysanthemum indicum and Lycopus europaeus. Among the water extracts, the strongest inhibition was from Polygonium cuspidium, which is an excellent source of the polyphenol resveratrol. Terminilla bellerica is native to parts of Asia, and it's an important medicinal plant in traditional Ayurvedic medicine. The fruit is the part that's used in medicine, and it's considered to have a wide range of benefits, including cholesterol and blood sugar lowering effects, protecting the heart, kidney and liver, and combating inflammation and oxidative stress. It's a source of many bioactive compounds, notably tannins and related constituents, that contribute to its usefulness in gout and arthritis. Specifically, it's believed to inhibit the enzyme xanthine oxidase, and this can account for its ability to lower the uric acid in both animals and humans. A 6-month double-blind placebo-controlled clinical trial, it was completed with 88 individuals who had elevated uric acid levels. The trial compared 500 milligrams twice per day of the fruit extract that was standardized to 15% tannins, to 250 milligrams of the same extract, a placebo, and 40 milligrams of the uric acid lowering medication febuxostat. The higher dose of the fruit reduced the uric acid concentration by over 27%, while the low dose was roughly half as effective, and the uric acid increased in the placebo group, while the subjects in the drug group reached the target uric acid concentration of less than 6 milligrams per deciliter in nearly 89% in the high dose, and 12% in the low dose also did. Flavonoids can lower blood uric acid by their ability to inhibit the enzyme xanthine oxidase. Olive leaf constituents, milk thistle, apigenin, myristotin, luteolin, and genistin have all shown the ability in lab experiments. Apigenin had an inhibitory activity comparable to the synthetic xanthine oxidase inhibitor allopurinol. In fructose-induced hyperuricemia rodents, quercetin, rutin, kaempferol, myristotin, and purin significantly reduced the blood uric acid levels, equivalent to healthy control animals. Grapeseed procyanidins were also found to lower the uric acid levels in rats with hyperuricemia. The procyanidin treatment animals exhibited normal growth compared to the animals treated with the allopurinol, which exhibited some retarded growth. While hyperuricemia and urate crystal formation are required for an acute gout attack, a contributing factor for chronic gout, inflammation, is clearly central to the disease. Several labs have investigated the chemical cascade that mediate the process. Under certain conditions, cells of the innate immune system, macrophages, reside within the tissue and they recognize the presence of urate crystals. Through a process that's still not fully elucidated, these cells are then stimulated to produce pro-inflammatory cytokines, particularly interleukin-1 beta, which recruit inflammatory white blood cells, the neutrophils, to the site of the crystal deposition. The circumstances surrounding the cessation of inflammation in acute gout are equally puzzling. Data suggests a yet undefined gout-promoting factor that must be present with the urate crystals in order for an acute attack to occur. Although it seems a reasonable assumption that an anti-inflammatory nutrient can have a role in mitigating gout attack, research in the specific area is still lacking. The quick progression and resolution of an acute gout makes it less amenable to nutrient interventions. However, the intercritical period between an attack has been associated with sustained low-level inflammation, a situation that more readily is addressed by dietary modification. Nutrients that have been shown to attenuate joint inflammation and reduce pro-inflammatory cytokines like interleukin-1 beta are curcumin, omega-3 fatty acids, and resveratrol, and these might be especially suited for this purpose. Experimental diets high in omega-3 fatty acid EPA and the healthy omega-6 fatty acid GLA were shown to reduce the urate crystal-induced inflammation in a rat model. For more on herbs, supplements, and natural treatment plans, check out my website.